Mr. President.
Senator from Hawaii.
Thank you, Mr. President. You might think that for the last 7 years that the major complaint that people had about the Affordable Care Act was that it hurt rich people, because they seem to be the only people who stand to gain with this Republican Senate health care plan. They get a giant tax break. The rest of America, on the other hand, is in trouble. With Trumpcare, health care will cost more, and 22 million people are going to lose their health care altogether. Some health care bill. To put this in perspective, imagine if everyone lost their health care in Hawaii, Maine, Nevada, Alaska, West Virginia, Ohio, Idaho, Wyoming. That's what Trumpcare does. That's 22 million Americans. It also devastates one of the best health care programs that this country has. With this bill, Medicaid is going to lose nearly $800 billion. So if your only worry is that your investment income gets taxed at 3.8% every year, you can breathe a sigh of relief. And let me drill down on that, because one of the most egregious tax breaks in this bill, and this is mostly a tax cut bill and not a health care bill, is the following. If you're making $200,000 as an individual or $250,000 as a couple, capital gains income is currently taxed at 3.8%. So if you're making either $200,000 as an individual or $250,000 as a couple, and you have capital gains, not regular income, it's taxed at 3.8%. This bill zeroes that tax out. This bill zeroes that tax out, and on top of that, it's retroactive. Think about the absurdity here. Here we are. I'm looking at the senator from Pennsylvania and how much he's advocated for children, and especially children with disabilities. I'm looking at the senator from Connecticut and the work that he's done with people with chronic diseases and mental health challenges and the resources that we need for that. And in the middle of a supposedly oriented towards health care piece of legislation, we're giving a retroactive capital gains tax cut to people who make over $250,000 a year in combined income. It is just absurd. It's not a health care bill. But if you have a loved one in a nursing home, if you're pregnant or thinking of having a baby, if your kid has a disability that requires costly care, if you work 2 jobs but your employer doesn't provide health insurance, then this bill does not take care of you. Instead of less taxes, you just get less care, and you're going to pay more for it. This is what happens when legislators don't have committee hearings, or they refuse to meet with patients, doctors, nurses, advocates, their own constituents. There have been so few town halls about health care. There have been so few real Senate debates about health care. I've seen every single Democratic member of the Senate come down here and talk about this piece of legislation. And I've seen every single Republican member of the Senate talk about legislation that they're proud of. I have seen very few people on the Republican side of the aisle come down and talk about this bill because they know it is not a good piece of legislation. At this point, we're not even debating health care policy. It's not a question of what's the best way to get people to sign up for insurance, or how can we lower premiums and deductibles, how can we improve the delivery system. It's a question of how many people are going to lose their health care so that insurance company CEOs can continue to make millions of dollars a year. That's literally what's in this bill. Those are the conversations we're having. Nothing related to actually reforming the health care system or getting people more coverage for less, but rather tax cuts for people who are involved in the healthcare industry. How many grandparents are going to get kicked out of nursing homes? That's not a rhetorical question. My wife's grandmother was in a nursing home 2 months ago. It was a beautiful facility in Waipio, Oahu. They took great care of her. They had 3 beds, 3 nursing home beds. The normal reimbursement, I think, is about $9,000 a month. They took wonderful care of my wife's grandmother. And they don't exist. That nursing home and all the nursing homes like it don't exist if there's an $800 billion cut to Medicaid. This is not a theoretical conversation. This isn't even a partisan conversation. Everybody's got nursing home beds in all of your home states. And everybody at least ought to know some middle-class people who rely on Medicaid for nursing homes. And CBO gave us the answer today. Too many people are going to be locked out of the health care system if this bill goes forward. And all for giant tax cuts. Look, our health care system is not perfect. Changes need to be made. But this bill is just not it. It has no clear guiding principle other than slashing Medicaid and to pay for tax cuts. And so we've got to start over here. I'm looking at a presiding officer who is the Speaker of the House who, in North Carolina, who understands how to do a bill on a bipartisan basis. I'm thinking of the numerous Republicans who are capable of working on a bipartisan bill that could get 60 votes. And by the way, the politics would change. Because if we worked on a bill that could get 60 votes, we would be in this wonderful position. The Senate is set up to encourage us to work together. Because if we abide by that 60-vote threshold and we come up with a bill together, we own the American healthcare system together. We don't get to play this blame game about what's happening with premiums or what's happening with coverage numbers. We actually, on the level, collaborate. And when you think about a bill or an issue that used to be as partisan as public education, you had Lamar Alexander and Patty Murray come together. Heck, in the last Congress, you had Jim Inhofe and Barbara Boxer do a bill together. It is possible for us to do a bipartisan piece of legislation. But the decision was made to go with reconciliation, and that is backfiring because the problem with not involving Democrats is that there are Democrats across the country. The problem with not involving experts is that you end up with a product that you can't defend. And so what we really need to do is take a breath, take the 4th of July weekend, and reconvene as a Congress, not as Democrats and Republicans, but as Americans who understand that our healthcare system is not perfect, that it is in need of improvement, but this bill doesn't get it done. I yield the floor.